Hi, my name is Caitlin Boyer and I'm a mental health nurse practitioner. What brings you in today, Erin? Thank you for sharing your story with me. I really appreciate it. Is it okay if I ask you some more questions to further understand what's going on? Great. Do you have any medical health problems in the last 6 months other than this rash? And I understand you saw your primary care physician about the rash. Is it right that the primary care doctor said it was a minor allergic reaction? Did the Benadryl help? What other symptoms are you having? Are you having any pain? Are you having any fatigue? You said you've been tired more recently. Can you tell me some more about that? You said your sleep is restless. Can you tell me more about your sleep? Are you having trouble falling asleep? Are you waking up frequently through the night? What causes you to wake up through the night? How many days a week are you having trouble sleeping? About how many hours of sleep do you get a night? Okay. You also told me that you are having some trouble concentrating. Can you tell me more about that? Is it causing difficulty in parts of your life, such as work or at home? Okay. You also, how are you eating? Okay. How have your relationships with your family and friends been? You told me that you've missed some of your family events and taken some time off work. Can you tell me more about that? How often is this nervousness bothering you? Is it every day? You said that you examine your whole body at least 20 or more times a day. Is it multiple times a day? Can you tell me more about how that makes you feel? Can you tell me about how that interferes with your daily life? Okay. How intense is this anxiety that you're feeling? How much of your day is spent thinking about your medical health? How is your physical health in general? Would you consider yourself healthy? How would you describe your symptoms, such as your fatigue and the rash? Is it severe or mild? How much of your life does it interfere with? You told me that you have a fear of developing some life-threatening illnesses. Do you have any known medical conditions that you're worried about? Do you have any no risk of developing medical conditions? You said you talked to your primary care doctor about some of your concerns. Is it okay if I talk to him as well, just to make sure that we're all on the same page and that I can get some information from him? Okay, great. You also told me that you're feeling pretty anxious. As a child, you had some medical problems. How often does that bother you and interfere with your daily life? Thinking or any flashbacks back to when you had medical problems as a child? Do you worry a lot about the problems you had in the past? How would you rate your worry from 1 to 10, 1 being no worry and 10 being the worst worry? Okay. So, Erin, I think what would help you is maybe we could start with treating some of these feelings around your medical problems and your fears, and maybe this will help you not be so preoccupied with your health. How does that sound? There's medications called SSRIs. I feel like they would help you with the worrying. I'll also talk to your primary care doctor about treating the medical illnesses. I hear that you have said that you've been told by physicians and doctors, medical staff in the past, that it's all in your head. I understand that you don't like to be told that. I totally get that. But I will talk to your primary care doctor and we'll continue to treat your medical problems. But I think some medications such as SSRIs can help with your anxiety surrounding these problems and your preoccupation, help your concentration, help your sleep, things like that. How does that sound? Okay. You also told me that you go on walks through the trails sometimes outside. Does that seem to help? Okay. Yeah, I think it's a great idea to continue to do activities that reduce some of the stress as well as maybe medication. Okay? All right. Well, thanks for talking to me today. And I hope we get you feeling better soon, get you sleeping a little better, and get you feeling better, okay? All right. Thanks.